Welcome to CE Institute. My name is Selena Belisle, and I am the founder and one of the instructors here where we teach prenatal massage. We do a lot of pre-recording for home study training, and sometimes we can take a clip of these video moments and share them for free on YouTube, not only as refresher training for past students who have taken our coursework, and it's also for people that have never seen our training before. It gives them an idea of what we're doing here at the school. Now we're going to review 10 of the more common changes of a pregnant woman's body and how they relate to prenatal massage. There are a lot of cardiovascular changes that can happen with pregnancy that could affect your massage. They're mostly hypertensive disorders, and you would need to learn more about which hypertensive disorder your client has developed, if they did develop one, to learn whether or not you should proceed with precaution or if your massage would be outright contraindicated. Now, pregnant clients will have their blood volume increased between 30 to 50% by the time they're ready for delivery, when they're in their full term of pregnancy. Now, different medical institutions have different numbers here, and not everybody's going to be the same as well. So some people will have slighter increases, some people will have greater increases and be very swollen. Also, pregnant women have about 10 to 20 beats per minute higher of a heart rate than usual. So their heart is beating faster with all this extra blood volume accumulating in their body, and that usually makes them more warmer than usual. Okay, but just because they're warm doesn't mean that you forego draping. You need to cover genital area and breast, keep those covered at all times, because it's really important to have very good boundaries with your client. Now, your prenatal clients with all this extra blood volume and cardiovascular activity, they are at an increased risk of developing blood clots or an embolism. A woman's physical boundaries might change too. When you're pregnant and you're going through regular medical care, you are subject to endless pelvic exams where you might have a group of med students come in and watch your pelvic exam with your OBGYN. And what I've found, especially with women who have had previous children, is now that they're pregnant, they're getting their massage and they're stripping right in front of you. And I want to speak out specifically to my male students who are here. Never let your pregnant client undress in front of you. And that goes for my female practitioners as well. You do not want to cross that boundary of nudity. Your client should never be excessively nude in your presence, and they don't need to undress in your presence either. So what I do, if they're undressing, I tell them, I need you to stop, or I have to step out of the room and get you a robe to put on or something. You can't be naked while I'm in the treatment room and not on the table. And the reason why I need them to stop is because I might need to show them how to get on the table, especially if I'm using a body cushion. So it's really important that you have clear boundaries, even when your pregnant clients don't. They might be really behind in their life and they're just rushing. Remember, one of the reasons they're there for your prenatal massage is to hopefully relax. Pregnant women are usually undergoing a number of psychological and emotional changes throughout their pregnancy as well. There are a lot of relationships that change when someone's pregnant, such as they probably don't feel comfortable going out for that once a week drink with the girls every Friday night or something like that. So their relationships change. If they're put on pelvic rest, their relationship with their spouse can change. Their relationship with their coworkers, their friends, their family is usually evolving with their pregnancy. So our goal as prenatal licensed massage therapist is to provide a safe place for your client to relax. Nothing's changing here. It's stable and comfortable and reliable. There are a lot of physical changes that happen with pregnancy as well. The average weight gain for a pregnant woman is 20 to 35 pounds. If they're suffering with hyperemesis gravidarum, they might not gain that much weight because they had a really hard time keeping hydrated and keeping nutrients. Some pregnant women will gain a lot more than 35 pounds as well. That's probably going to create new aches and pains in their body when they do so. Most pregnant women have to purchase new clothes to accommodate their ever-growing abdomen. We're showing on the right-hand side here how the pregnant abdomen grows upwards and outwards with each month of pregnancy. And on the left-hand side, we have a medical illustration that shows each trimester how the uterus expands. And in the 9th month of pregnancy, during the final stages of pregnancy, that uterus will start to drop to a lower position. So that extra weight, regardless if they're underweight, within normal ranges, or overweight, does create extra pressure on joints, which that can create pain, and they will likely seek massage to relieve pain. That's one of the number one reasons why a pregnant woman would book a massage. They have a pelvic tilt that starts with the ever-growing pregnancy and an increased lumbar lordosis to keep balance. The relaxin hormone literally allows the pubic symphysis and the sacroiliac joints to relax further, widen to prepare the birth canal for birth. And that changes their gait pattern. Their steps lengthen and they might have some issues with balance. Breast enlarge, usually with pregnancy, sometimes up to 2 cup sizes. That's why it's important that if you're going to use a body cushion system, that there is a breast recess for swollen breasts so it's not painful to lie on them. Also, swelling occurs with pregnancy, and what happens is that growing uterus can put pressure on blood vessels of the body, and if a client already has varicose veins, it usually makes their varicose veins even worse than what they were before the start of their pregnancy. There are metabolic changes that help pregnant women get to that 20 to 35 pounds of extra weight that they should have to have a normal, healthy pregnancy. Keep in mind, your fetus is usually not much more than 10 pounds, so 15 pounds plus is outside of the actual baby weight. It's your amniotic sac and fluid and reserves within your own body to nourish not only yourself, but the growing person inside of you too. So carbohydrates and protein metabolisms are affected with pregnancy, and pregnant women will crave additional calories. Sometimes they even crave things like dirt, and that's a mineral deficiency. That's why we have prenatal vitamins for pregnant women to take specific for their individual needs. Pregnant women should be eating up to 300 extra calories per day and up to 70 grams extra protein per day above normal ranges. And their prenatal vitamins should definitely have folic acid, very helpful for pregnancy. Pregnant clients will also have a number of hormonal changes happening within their body. The HCG hormone is what's tested for to determine if someone is pregnant. That is a human chorionic gonadotropin hormone, and it's the pregnancy hormone that nourishes the egg after it's been fertilized. Pregnant clients will also have progesterone hormone increasing in their body that encourages the growth of milk-producing glands. Estrogen is going to enable the uterus and the placenta to improve vascularization for the fetus and improve that nutrients exchange between the mother and the baby. Prolactin is going to help make breast milk. Cortisol is our stress hormone, and unfortunately, that increases with pregnancy, as well as aldosterone, which helps increase that extra blood volume towards the latter stages of pregnancy. These hormonal changes are what is contributing to hyperpigmentation changes in the pregnant client's body. They develop what's called a pregnancy mask, otherwise known as chloasma or melasma, and they can also develop linea nigra, which is the longitudinal line that runs down a pregnant woman's abdomen. Relaxin hormone alone is on the rise in a pregnant woman's body. That's really good for pregnancy, but not so great for other things. Your relaxin hormone is preparing the uterus for pregnancy. It relaxes the ligaments and it allows the pelvis and cervix to expand and widen to prepare the birth canal for a large fetus to come out. It also inhibits uterine contractions in early pregnancy, but that relaxin relaxes the sphincter that prevents the gastrointestinal contents from running up into your esophagus. And most pregnant women will have heartburn from that. And also, as the joints expand, it can create new pains and new aches for your pregnant client as the body's preparing itself for birth. It's also affecting other joints, and it's not always comfortable. Renal changes are happening in the pregnant woman's body as well. As that fetus continues to grow, it's putting pressure on most pregnant people's bladder, and also they have an increased kidney and urethra size. They can both expand with pregnancy too. The majority of pregnant women are affected by gastrointestinal changes. Most feel nauseous and will develop morning sickness at the beginning of their pregnancy. That can lead to vomiting and dehydration, and in extremely severe cases, that could be diagnosed as hyperemesis gravidarum when they're not able to keep anything down whatsoever. Also, heartburn can happen due to the hormonal changes that allow the stomach contents to back up into the esophagus. Several of the changes we've already reviewed could be considered physiological changes, which are abundant amongst pregnant clients. They can become swollen, they gain weight, they have hormonal changes, hypertensive disorders, and more. Pregnant women can feel faint or dizzy throughout their pregnancy as well, and there's a number of reasons that can contribute to this. First, they might have developed pregnancy-induced hypertension, PIH, or any other hypertensive disorder, and now they're on blood pressure medication. When you're on blood pressure medication, that dilates the blood vessels, and hormones can also dilate the blood vessels. When the blood vessels are dilated and a client lies down for a period of time and then they suddenly sit up, like at the end of a massage, they could have a sudden spike or drop of blood pressure, and that could make them feel faint. Okay, so at the end of the massage, specifically with pregnant women in their latter stages of pregnancy, or anyone who's taking blood pressure medication while pregnant, I will stand with them for a minute after they've sat up to make sure that their blood pressure normalizes before I allow them to dismount the table. I will leave the room so they can dismount the table and get dressed on their own. But if I think that their blood pressure might need to adjust, I will literally have them sit there on the massage table, just covered with their sheet for a minute while we're allowing that blood pressure to normalize. Also, pregnant women can have low blood sugar levels, or they can become anemic, especially when they're not taking their expensive prenatal vitamins or following dietary recommendations. Those can also cause dizziness. And as a pregnant woman becomes more and more pregnant, you have this fetus inside of there that can be literally pressing up against the inferior vena cava, the inferior aorta, and obstructing blood circulation could also contribute to dizziness. So that's just a snippet of what we review in some of our prenatal massage and bodywork training here at CE Institute. We share so much more than this. We would love to see you register for some of our prenatal training. To learn more, please visit our website, ceinstitute.com. We do have a free training tab there, and there might be more lessons listed on our website for free. And of course, you can register for any of our paid training classes as well. We'd love to share more with you, and we hope to see you back. Until we see you in a training, be safe.